Dr. Karan here, a small video about does your ethnicity affect which blood pressure medicine you should be on? You'd be surprised that your ethnicity can significantly influence the effectiveness of certain blood pressure medication, particularly due to genetic, physiological, environmental differences that affect how individuals respond to antihypertensive drugs. And here's a breakdown by major ethnic group based on evidence and current clinical guidelines. So, if you are African American patients, they often have low renin hypertension. They're more salt sensitive uh, in terms of blood pressure, and there's a high risk of hypertensive complication. So for African American patients, more effective medications are calcium channel blockers like amlodipine or diltiazem or nifedipine, verapamil. So that's one calcium channel group. Other one is thiazide diuretics like chlorthalidone, hydrochlorothiazide. Those are better medication. Less effective medication as a monotherapy for African American patients are ACE inhibitor like lisinopril, benazepril, ramipril, or ARB like losartan, telmisartan, valsartan. And ACE inhibitor that are associated with higher rates of stroke and angioedema in this population if used alone. So clinical guidelines for African American patient is to start with a thiazide diuretic or calcium channel blocker unless there is a compelling reason. Um, like for example, diabetic patient with a proteinuria or chronic kidney disease, then we have to use ACE inhibitor or ARB. Now for white European descent patients, they usually respond very well and they have a balanced response to a wide variety of antihypertensive medication. And effective first line options for them are ACE inhibitors like lisinopril, benazepril, ramipril, or ARB like losartan, telmisartan, valsartan. And then is calcium channel blocker like nifedipine and amlodipine or similar medication, or thiazide diuretics like hydrochlorothiazide and chlorthalidone, etc. For Asian patient, they have greater sensitivity to beta blockers and ACE inhibitors. They have increased risk of side effect with ACE inhibitors like cough. And for them, the preferred agents are ARB, like losartan, telmisartan, valsartan. Is better tolerated than ACE inhibitor like lisinopril. And calcium channel blockers are very effective. For Hispanic Latino patient, it has been studied less specifically, but generally respond well to calcium channel blocker and diuretics. And other consideration, I think that people with a chronic kidney disease, regardless of ethnicity, ACE inhibitor and ARB like losartan, they are preferred medication, particularly the patients with a protein in the urine or diabetic patient. Combination therapy often needed in most ethnicities, especially in moderate to severe hypertension. Pharmacogenomics is a growing field where genetic testing is done, and that really spells out very clearly which medicine is going to work and which is not going to work. So again, I'm going to recap it. African American, first line option, calcium channel blocker and thiazides diuretics. Second line is ACE inhibitor like lisinopril or ARB like losartan. White European, ACE inhibitor or ARB, calcium channel blocker, and then thiazide diuretics. Asian people, calcium channel blocker and ARB. Hispanic and Latino, calcium channel blocker and thiazides diuretics. So thank you for watching. Have a great day.